Trigger points that refer pain to the hip are as follows. First, in blue, we have the Quadratus lumborum trigger points. The lower QL trigger point refers pain to the greater trochanter or hip region. Next, in red, we have the Tensor fascia lata trigger point, which refers pain to the greater trochanter and down the lateral thigh. Next, in pink, we have the Gluteus minimus trigger points, which refer strong pain to the greater trochanter and down the lateral aspect of the thigh and leg. And lastly, in green, we have the Piriformis trigger point. The lateral trigger point in this muscle refers a strong pain to the greater trochanter. Clinical findings for trigger points in the Quadratus lumborum muscle are as follows. Dr. Travell refers to this muscle as the joker of low back pain because it is very frequently overlooked as a source of lower back pain. Clients may complain of pain in the iliac crest, sacroiliac joint, buttock, and groin regions. They will complain of a deep aching pain at rest, but is excruciating while in an upright, unsupported posture. Because of this, you'll often observe clients using their arms to support their upper body while walking or sitting. They may complain of a sharp, knife-like pain in their lower back. Rolling to either side while laying is extremely painful, something the therapist should be aware of when the client is on the table. Coughing or sneezing aggravates their pain. Pain can extend into the groin and/or the scrotum. Chronic pain of this type frequently causes emotional depression and loss of vitality. Some factors that may activate or perpetuate trigger points in the Quadratus lumborum muscle include automobile accidents, awkward lifting of heavy objects, stooping while twisted to reach for an object on the floor, putting on pants while standing, gardening, walking or running on a slanted surface, sleeping in a soft bed with a hammock-like sag, chilling of the muscle during sleep, and lower limb length inequality, where one leg is shorter than the other. Clinical findings for the Tensor fascia lata muscle. Dr. Travell refers to this muscle as the pseudotrochanteric bursitis muscle, and clients will complain of pain and tenderness in the hip region. The pain may extend down to the knee, and typically the pain prevents the clients from lying on the affected side. Some activating and perpetuating factors for trigger points in the Tensor fascia lata muscle include landing on the feet from a high jump, jogging with the pronated foot, walking or running on sloped surfaces, sitting for long periods of time, as when driving, and sleeping in the fetal position. Clinical findings for gluteus minimus trigger points. Dr. Travell calls this muscle the pseudosciatica or side sciatica muscle. Clients will typically complain of pain in the buttock, hip, posterior and/or lateral thigh and calf. They may also complain of hip pain while walking, which causes a limp, pain while rising from a chair. The pain may be constant and excruciating and is unaffected by positioning, similar to that of a disc herniation. Some activating factors for gluteus minimus trigger points include limping because of a lower leg or foot injury, walking or running on uneven ground, intramuscular injection, prolonged immobility, such as driving a car for long distances, true SI joint dysfunction, and sitting on a wallet. Clinical findings for the piriformis muscle. Dr. Travell refers to the piriformis muscle as the double devil because trigger points in this muscle can cause pain in two ways. First, by the referred pain to the sacroiliac joint and or the hip, and second, by a condition known as piriformis syndrome, where a tense piriformis muscle compresses the sciatic nerve as it exits the pelvis, causing sciatica symptoms such as radiating pain, numbness, and tingling that travel down the leg to the foot. Some factors that may activate or perpetuate trigger points in the piriformis include the pain associated with true sacroiliac dysfunction, sudden foot slip, twisting sideways while bending and lifting, running, sexual positioning, impact trauma, car accident, chronic pelvic inflammatory disease, and hip replacement surgery.